HCSC 114, Intro to Pharmacology, Chapter 5, Analgesic Drugs and Musculoskeletal Drugs. In this chapter, we'll talk about disorders and medications that impact bones and muscles. Your learning objectives are shown here. They are also listed at the start of the chapter. First, we'll discuss analgesic drugs. Analgesic drugs are used to treat pain. Onset that is sudden and severe is known as acute, whereas if pain continues for 3 months or longer, it is considered to be chronic pain. There are different types of drugs classified as analgesic drugs or pain-killing drugs. They include non-opioid analgesics, opioid analgesics, and then combinations of opioid and non-opioid. Non-opioid analgesic drugs are the first step in pain control. Their advantages are they are non-addicting, inexpensive, and many of them are available over the counter and can be purchased without a prescription. The disadvantage of non-opioid analgesics is they are only effective in treating mild to moderate pain, and many can cause stomach bleeding and ulcers. With chronic and heavy use, they can also cause liver and kidney impairment. The first class of drug are the salicylate analgesic drugs. Salicylate drugs include aspirin, which is known as acetylsalicylic acid, and other chemically related drugs. Salicylate drugs have three therapeutic effects, identified by analgesia, meaning that they treat pain, antipyretic, which means that they treat fever, and anti-inflammatory. They reduce inflammation by binding to prostaglandins. However, that's the part that also increases the risk of ulcers. Now, aspirin has a unique effect in that it's got a fourth therapeutic effect. It's actually an antiplatelet. The textbook chapter notes it as an anticoagulant, which, if we're getting technical, it is not. Antiplatelets work differently than anticoagulants. However, the outcome of both are that they slow down the clotting of blood. So when patients are taking non-opioid analgesics from the salicylate class as well as the NSAID classes, we have to note that the patient may have longer times for their blood to clot. Aspirin, used long-term, is known to cause ulcers. To help reduce stomach irritation, aspirin is available as enteric-coated. This changes so that it won't dissolve in the stomach, but will only dissolve in the higher pH region of the intestines, so that it causes less stomach irritation. We also may combine aspirin with antacids to help buffer and protect the stomach. An interaction with aspirin in viral infections can cause a condition known as Reye's syndrome, especially in children. Because of this interaction, acetaminophen is recommended to treat aches, pains, fever of cold, flu, and herpes varicella, which is the chickenpox. An abbreviation for aspirin would be ASA, for acetylsalicylic acid. So here are two images of aspirin. We have the Bayer aspirin, low dose. This is an 81 milligram. Many people will take this for heart health. And then Ecotrin, it's enteric-coated aspirin. And this one's going to help protect the stomach. Another salicylate drug is magnesium salicylate. Magnesium salicylate targets muscles much better, and DOMS, these are backache tablets, are very effective at helping relieve backache pain. The next non-opioid analgesic are non-salicylate analgesic drugs. This includes the drug acetaminophen, which is a simple analgesic. Now, the abbreviation, if you recall when I talked about drug names, the chemical name being acetyl para-aminophenol, we abbreviate that APAP. So acetaminophen can be abbreviated. You may see an order from a physician, APAP. Now, acetaminophen only has two therapeutic effects. It has analgesic properties and it has antipyretic properties. So it treats pain and it treats fever. It is not an anti-inflammatory. It will not work on the inflammation component. Over-the-counter acetaminophen is available as tablets and capsules, also chewable forms, oral liquids, syrups, and suppositories. And it's also available as an injectable medication. Acetaminophen, by the trade name of Ofemev, is the injectable formulation, and it's administered intravenously. Now, it is important for patients to be aware that overuse of acetaminophen can cause hepatotoxicity. It can be damaging to the liver. So here's an image of extra strength acetaminophen, which is 500 milligrams. The regular strength is 325. Patients should not take more than 1,000 milligrams, 2 of these extra strength at one time. And actually, the FDA advises not to exceed 4,000 milligrams, which is 4 grams, of acetaminophen each day. So patients, unfortunately, a lot of times when patients are self-medicating with over-the-counter products, people have the kind of mindset that more is better, like supersizing your meal at McDonald's kind of thing. That is not true. 2 is going to be 3 aren't going to give you any more relief than 2 would. So patients need to make sure that they're following the instructions on the bottle. Then we have combination non-opioid analgesics, and they can contain different medications. The first one is going to be a combination of acetaminophen, aspirin, and caffeine. This is known as Excedrin, and it's noted as being extra strength because it's got 2 pain relievers. The acetaminophen helps. Most people know Excedrin is generally used for a headache. The acetaminophen and the aspirin work as pain relievers, and then the caffeine actually helps to get the drugs absorbed more quickly. Now, just a thing to know, because some of you may have seen this packaging, which is Excedrin migraine, and we know it's both got acetaminophen, aspirin, and caffeine, and they're the exact same strength. It is just the packaging that is different. This is the only over-the-counter product that has been approved by the FDA to be labeled as a migraine relief, but it's exactly the same drug. It's just different packaging. Now, another drug, now this is a prescription drug. It's got butabital in it, which is related to a barbiturate. It is a controlled substance, depending on what other ingredients. Sometimes it also has codeine in it. Most often this would also be used for a migraine. Butabital with acetaminophen. Bupap is what they've listed in the book. It is sold by other names when it has caffeine added. With caffeine added, it's known as Fioricet or SJ. But again, these are usually prescribed for migraine headaches. Non-steroidal anti-inflammatory drugs are considered to be non-opioid analgesics. They have the abbreviation of an NSAID. It stands for the non-steroidal anti-inflammatory drug. We're comparing it to a steroid. If we're talking about inflammation, steroids are the bigger guns. They're going to be the more potent. A non-steroidal will still treat inflammation, just not quite as well. Many of these drugs have the drug stem of Profen. However, not all of them have the drug stem of Profen. There are a few other drug stems. They're mostly used to treat mild to moderate pain. They block the production of prostaglandins, and that results in the reduction of pain and inflammation. But it also, disrupting the prostaglandins disrupts that protective action in the stomach. So when I talked about the GI drugs back in chapter 4, prostaglandins help protect that mucous membrane in the stomach. If we're blocking it, that's not going to be there. So salicylates and NSAIDs, which salicylates are technically a category of NSAIDs, we see ulcers as a long-term heart complication. But it may cause heartburn or indigestion or ulcers. Ibuprofen is the prototype drug in the NSAID class. So ibuprofen ends in that profen, and it has 2 brand names, Advil and the other is Motrin. Now, patients who are allergic to aspirin should not take NSAIDs. There is also a cross-sensitivity. Another subcategory of an NSAID is, oops, I'm jumping ahead. Okay. Another type of NSAID is Mobic. This is meloxicam is the generic name. Mobic is the brand name. And this is a pretty effective anti-inflammatory. Patients use this a lot for arthritis. And then we have the COX-2 inhibitors. That was where I was going next. COX-2 inhibitors are a subclassification of NSAIDs. They end in coxib. We see that here on this label. The brand name is Celebrex, so those kind of relate. Celecoxib, Celebrex. And if you've seen the TV commercial that used to run, they would sing the song Celebrate, Good Times Come On, to help remember, because you're no longer in pain, you no longer have inflammation, so you can dance and you can celebrate. Now, most NSAIDs come in an oral dose form. Some do come injectable. Ketorolac, Toradol is one that comes injectable, but that one also comes as a nasal spray, which has a systemic effect. And then some come topical. So diclofenac, it comes oral, but it also comes in a topical gel known as Voltaren. Maybe you've seen that. It's in a orange kind of package. We'll see an image of that coming up later in this lesson. Now the gel is available over the counter, but the oral formulation of diclofenac and the transdermal patch version, those require a prescription. There are also combination drugs. So the drug Arthrotec is a combination of diclofenac, the NSAID, with misoprostol, which we talked about with ulcers, Cytotec. So here we have Arthro. It's for people with arthritis, but it's got that Cytotec Protect part for the stomach. And if you remember, misoprostol is a prostaglandin drug, and because it's going to stimulate prostaglandins, it can actually cause uterine contractions. So we do see that image of the pregnant, don't take if pregnant on here. So Arthrotec, it's for arthritis, but it's got that misoprostol to protect. So it's going to help prevent ulcers. Now, other combination drugs will contain an NSAID, but it may also contain either an H2 blocker or a PPI, a proton pump inhibitor. So there's a number of different types of combinations. But again, the reason for the combination is to give the anti-inflammatory property, but protect the stomach from ulcers. The next one is an N-type calcium channel blocker, analgesic. They block nerves in the spinal cord, and these are reserved for severe chronic back pain, and they're actually given intrathecally, which means they're given into that spinal area through an infusion pump. Now, Zaconotide, I promise I practice all these when I'm writing the notes, and then when I go to speak it, my tongue gets all twisted up. Zincanide is Prialt, and it actually comes from the venom of a cone snail. Kind of weird, right? All these weird animals. How do we find things? But it's actually stronger than morphine, and it's going to have a more direct impact being that it's intrathecal without a big systemic effect. So it's going to help with that back pain without causing a lot of systemic side effects. So those are the non-opioid analgesic drugs. Next are the opioid analgesic drugs. Now these are used to treat moderate to severe pain. The term opioid is our common verbiage that we use. Previously, these were referred to as narcotics. Sometimes we still use that term. In addition to treating pain, opioids can produce sedation as well as euphoria, kind of a high, and that's part of the issue that can lead to addiction. Opiate drugs are drugs that come from a poppy plant, where an opioid, it means like, if it ends in oid, those are synthetic opiates. We do use those terms interchangeably, but there is a real differentiation in the terms, but most times we're not going to really be worried about that. Now, all opiates require prescription, and most of them will be controlled substance. On your list in your textbook, the one that is not a controlled substance is nalbuphine. Meperidine is a synthetic opioid. It has a trade name of Demerol. It is a controlled 2 drug, and it's administered orally as well as via injection, which could be administered intramuscularly. We see down here, it's kind of rolled. It's IM, subcutaneous, or IV injection. Demerol is kind of the synthetic morphine. Now, with morphine, the Joint Commission, a lot of times we use the abbreviation MS for morphine sulfate. The Joint Commission says that that is a do not use abbreviation because it could be mistaken for something else. So we're going to write morphine out. Now, it is a C2 drug, which we're also seeing here on this label. Now, this is also administered injectable, and morphine does come oral as well. And in the oral formulation, it could be a regular release or it could be an extended release. An extended release morphine might be something like MS Contin. And there they're using the MS that I just told you they shouldn't be using, but it's part of a name. Oxycodone is a very commonly used pain reliever. Oxycodone is related to morphine. It is a C2 drug, as we're seeing here. It's known, one of its brand names is OxyContin. Another is Roxicodone. Anything that ends in Contin, like I was saying, the MS Contin, that means it's extended release. They're only supposed to take it twice a day. Roxicodone is another brand name for oxycodone. And these are standalone narcotics. They're not a combination narcotics. Both of these, anything containing oxycodone is a C2 drug. Next is fentanyl. So we hear a lot about fentanyl in the news. It's very, very potent. It takes a very small amount, just a few granules, to be an overdose. It's sold under a number of different trade names, and most of that is based on the route of administration. All forms are C2 drugs. So here I have an image of Actic. Actic is fentanyl lozenge or troche. It's actually what we refer to as a lollipop. So if somebody has maybe mouth cancer, they would use this and park it in their cheek and let it dissolve. Fentanyl is also available as a transdermal patch. One of the brand names is Duragesic. Here is just a fentanyl transdermal system. We do need to make sure that we're paying attention to these boxed warnings and things on the packaging. There's special considerations. If you go into pharmacy, we'll talk much more about that for patients who have prescription medications that they're taking home. Now, Duragesic being a transdermal patch, the patient puts it on and it's stays in place for 72 hours. So they use it, the patch stays in place for 3 days. Before applying their next patch, they need to remove their old patch and then put their new patch on. Fentura is another brand name for fentanyl. This is a buccal tablet. So they're going to put it in their cheek and they're going to let it dissolve, and it's going to absorb through their bloodstream. And then Subsys is a sublingual liquid. Now, other drugs that your book talks about, opium. Opium is not used to treat pain, but we do use the drug opium to treat diarrhea, and it's actually in an elixir or a tincture. Paregoric is a tincture of opium, and it's a control 3, and it's used for diarrhea. Patients who use narcotics long term, it is important to note that one of the main side effects of long-term use of opioids is constipation. So I talked a little bit about that in the GI tract with the medications to treat opioid-induced constipation. So oftentimes, to prevent constipation with long-term use of opioids, patients are also told to use a laxative, a stool softener daily, or a prescription medication. Another medication in the opioid analgesics was methadone. Methadone is used to treat pain, and it's used to help people who are addicted to other narcotics. It works differently in the brain, so it doesn't have the high that goes along with some of the other medications. So especially if patients are using street drugs and we want them to be safe, they might go into a methadone protocol. Methadone is a C2 drug, but again, we do dispense it for pain. So just because somebody's coming to get methadone doesn't mean maybe they're an addict. It might be used for pain. Now, when we talk about the prescribers, your physicians, your physician assistants, or what I've learned recently is they have updated their name and they are now being referred to as physician associates, dentists, nurse practitioners. Again, they all have to register with the DEA and get a DEA number. They're also going to have to register with whatever the identified state agency that oversees controlled substances. In Louisiana, that's the State Board of Pharmacy. So even a physician has to be registered with the State Board of Pharmacy. Now, prescriptions for opioids have to be written on tamper-resistant prescription pads if it's a C2 drug. They have special security features. And then also to note, the state boards of pharmacy will oversee the PDMPs, which is the Prescription Drug Monitoring Program. When people come to pick up their controlled substances, we swipe their ID, and it helps keep track of, are they taking their medications properly, or are they abusing their medications, or potentially even drug seekers. Now we have combination opioid and non-opioid analgesics, and basically there's 2 reasons for that. The non-opioid provides a foundation of pain relief to build on, so we can reduce the amount of the opioid. Also, by using a combination, you get less side effects from both sides because we can use a little bit less of each. The therapeutic effect is treating the pain from 2 different places. So that can also help. Different combinations can result in different controlled schedules, and common drug stems for the brand name products that contain acetaminophen is they end in set. So one of the prototypes here is Percocet. It ends in set. It's got acetaminophen. It's oxycodone with acetaminophen. I should have looked at this label a little bit more clearly. I keep doing this, right? I get excited when I see one that's clear. A few years ago, they changed the law, and you can't have 500 milligrams of acetaminophen. The maximum you can have in a combination drug is 325. So the amount of the oxycodone can change. We could have 5 milligrams, we could have 7.5 milligrams, or we could have 10. but it's going to be either 300 or 325 milligrams of acetaminophen. So oxycodone with acetaminophen, Percocet. Then we have hydrocodone with acetaminophen, and that comes by a number of different brand names, one of them being Norco. And here you see that 325. It'll have the amount of the narcotic first and then the amount of the acetaminophen behind. Now this one doesn't have that set at the end. Vicodin is another brand name. HP means high potency. Again, that 660 is no longer there, but it would be the 10 milligram. And then we have Lortab, hydrocodone with acetaminophen, the 5-325. The next section is on drugs that are going to impact how muscles associate. So common disorders associated with muscles can include strains and sprains, muscle spasms. So along with analgesic and anti-inflammatories that are used to treat pain and inflammation, the muscle relaxants can help relieve spasms and stiffness. So when we talk about the different drugs in the group, the one on your drug list includes Carisprotol, which is known by the name of Soma. Soma means body. It is a controlled substance. It hasn't always been, but it is now. But it's a muscle relaxant. So if somebody's got a sprained back or something like that, or a whiplash, they might be using Soma. And another really good muscle relaxant is actually a benzodiazepine. So diazepam, right? It ends in a PAM for Zapam for a benzodiazepine. This is Valium. And I just put the picture of the brand name from Roche Laboratories. They actually cut the V out the center. So Valium. Now, generic's not going to have that. It's just going to be a scored tablet. But Valium, when we talk about benzodiazepines, it's got a lot of purposes. This is the only benzodiazepine that has muscle relaxant properties. So again, if somebody's maybe in a car accident and they have a back sprain, they might be taking Valium. Another drug that's on your drug list that's used to treat muscle pains is the drug methocarbamol. This is known as Robaxin. And I think at the back's in. When your back's out, take the medicine, now your back's in. So this is a muscle relaxant. A lot of times with Robaxin being prescribed, some doctors will prescribe it for people who get tension headaches to help relieve the tension in their neck from the muscles tensing up. And then the next one is Baclofen. So I put these on your worksheet. These are kind of prototype drugs. Baclofen comes in multiple forms. It does come oral as well. Most often the oral is going to be generic, but it comes Lioresal or Gablofen. Those come injectable. These are for spasticity. We use it a lot in patients who have muscular sclerosis. And then it also comes as an oral solution, which is Ozobax. So multiple dose forms for the muscle relaxants. Now your book categorizes your botulinum toxins as a neuromuscular blocker drug, which it technically is because it's blocking your muscle's response from the nervous system. So what happens is it paralyzes the muscle. These are going to be injected basically through infiltration. They're going to be injected kind of like you get Novocaine for a toothache. When you're getting dental work done, it's only going to work in an area. It's not meant to be systemic. These drugs come from a neurotoxin of the same bacteria that causes botulism. They're administered by injection. Cosmetically, they're used to relax muscles in the face and help minimize deep wrinkles. However, they're also administered around the peripheral of the head and neck to help relieve migraines. So the prototype is abobotulinum toxin A, which is known as Dysport. So I've got that over here. They have on the name here Clostridium botulinum type A, but it's a abobotulinum, and then Botox. So we've all heard of Botox. Fibromyalgia is a disease where there is hyperirritable trigger points in the muscles of the neck, back, or hips. They're very firm, but also very tender to the touch. Their symptoms can also include fatigue, poor sleep patterns, depression. We don't know what causes fibromyalgia. It's algia being pain, my being muscle, so it's fiber muscle pain. It's quite a different menu of list of potential symptoms, and the patient out of this whole big menu only needs a few of them to be identified as fibromyalgia. We don't know the cause, but it could be an overreaction to pain, or something's gone wrong to cause damage or injury. There could be a genetic predisposition, or it could be stress. It could be a malfunction of the nervous system. We really just don't know. But like I said, if there's a certain set of symptoms, then it could be classified. So we're going to look at the drugs, the two main classifications used to treat fibromyalgia. And the first one is a GABA analog. This is known as a GABAergic drug. There's a neurotransmitter known as GABA. It's inhibitory. It calms things down. So with fibromyalgia, there's some irritability of the nerve endings at the muscles. So we're going to calm that all down. So they're going to inhibit that nerve signal from the brain to the spinal cord. Now, a lot of your GABAergic drugs will have GABA in the drug name. Gabapentin is one of them. That is Neurontin. These are actually often also anti-seizure medications. So we'll talk about them again. But Lyrica, pregabalin, GABA in the middle, is more for fibromyalgia, even though technically it is an anti-seizure medicine. Lyrica is the brand name. It is a control 5. Not all GABAergics are control substances. But your benzos are also considered to be a GABAergic drug. So those are all C4s. So many of them are controlled substances. But again, with a GABA drug or a GABA analog, you're going to look for that GABA somewhere in that drug name. And this is going to help calm down that pain in the spinal cord receptors. We also use antidepressant drugs. So SNRIs, or serotonin norepinephrine reuptake inhibitor drugs, are a type of antidepressant drugs. They also are disrupting the way that the body is responding to specific neurotransmitters, which helps alleviate pain. So here we have duloxetine, and Cymbalta is the most commonly referred to brand name. But it does also come as Drizalma sprinkles. So again, previously I noted when I talked about dose form sprinkles, they come in a capsule, but you're supposed to open it up and sprinkle it out onto some kind of food product, like applesauce, pudding, yogurt, something along those lines. SNRIs inhibit serotonin and norepinephrine from stimulating the nerves. So in addition to the above classes, fibromyalgia can also be treated with anesthetic drugs and corticosteroids that can be injected into the trigger points in the muscle. Now, the musculoskeletal system is composed of two interconnected body systems, the muscles and the bones. And next we're going to talk about the bones. So although mature bone is hard, it is also a living tissue and undergoes changes. Diseases that affect bones include osteoarthritis, rheumatoid arthritis, and osteoporosis. So starting with osteoarthritis, this is the most common form of arthritis. It is a degenerative disorder. It usually occurs with injury or age, and the main symptoms include inflammation, pain, and swelling. Drugs used to treat osteoarthritis, or what we refer to as OA, include agents that decrease inflammation and reduce pain. Drugs that do this also inhibit prostaglandins. Are we hearing a lot of repetitive information, a lot of things that link back? So the first thing we're going to talk about is using acetaminophen for osteoarthritis. Again, this isn't going to help with the inflammation. It's not going to help with that part, but it will help with the pain. It's not an anti-inflammatory. But if somebody's allergic to aspirin, we at least want to give them some pain relief. If their knee hurts or their hands hurt because they have arthritis in their fingers. Now, the other benefit of acetaminophen as a pain reliever is it doesn't irritate the stomach. But like I said before, don't overuse it because it can cause problems with your liver. So I already talked about diclofenac as an NSAID previously, just talking about NSAIDs for pain, but they also treat inflammation and arthritis. Anything that ends in itis means inflammation. Osteobone, arth, joint, inflammation. So it's inflammation of the bones and joints. So we have many OAs or NSAIDs that are beneficial. I talked about meloxicam, ketoprofen, ibuprofen, naproxen. There's a number. Even diclofenac taken orally, but I was telling you that Voltaren gel is now sold over the counter. So this is the original prescription strength, but it's sold over the counter. And you just put it on the joint, and it helps to relieve the pain. Now, they work by inhibiting prostaglandins, producing that analgesia and that anti-inflammatory properties, helpful in treating long-term, even moderate to severe, as well as chronic inflammation associated with osteoarthritis. Now, because arthritis is inflammatory, if you want to reduce inflammation, the best weapon we have is corticosteroids. Corticosteroids are potent anti-inflammatory agents. That's why the others are called non-steroidal. They're being compared to the steroid. You always compare it against the biggest, the best, right? These are drugs that act like hormones that your body would secrete from your adrenal glands. They can be administered orally or by an intra-articular injection, which means they're going to inject it directly into the joint. Prednisone, known as Deltazone or Prednisone Intensol, is this is the prototype drug. Can be oral or it could be injectable. Now, understanding dosing of your steroids. So your textbook, this is the image from your textbook. This is prednisone. This is known as a tapering dose. Many times they come in these special dosed cards, and we see that each day the amount will be decreased. So the first day they take the highest amount, and on the back it'll actually tell them take 2 with breakfast, 2 with lunch, or take 1 at breakfast, 2 at lunch, 2 at dinner, 1 at bedtime. And then the next day they take 1 less tablet. And then the next day they take 1 less tablet. And part of that is because steroids, our body makes steroids. And when we add the drugs in, our body has a system. It's checking our levels, kind of like a thermostat, checks the temperature. And when the levels drop, the air conditioning comes on, like if it gets too warm kind of thing, or in the winter it gets too cold, the heat's going to kick in. Well, that's called negative feedback, and your body kind of works the same way. Your body's kind of got these little sensors and says, okay, what's our level of hormones? And if the level drops too much, message is going to go to your adrenal glands to make more hormones. The challenge is when we put a high dose of hormones into the body, the adrenal glands feel like, hey, I don't have to work today. The levels are where they're supposed to be. I don't need to make more. And the longer a patient is on a higher dose, the higher the chance they could potentially have adrenal insufficiency. Their adrenal glands could just say, I'm on permanent vacation. So we use this tapering of dose. So each day it's like, okay, so day 1, yeah, the adrenal glands, I'm good. I can take the day off. I don't have to do anything. The next day, ooh, I need to start getting back to work, but I'm not fully there yet. Okay, I'm doing a little bit of work on this day. Okay, the next day the body's doing a little bit more work. So where we're missing these tablets, that's the body's part. And as we get down to the end, they're ready to be full on working that day. Other drugs that we can use to treat osteoarthritis are some over-the-counter topical agents. The first one is capsaicin. So capsaicin actually comes from the membrane on a chili pepper. It's really important because it is from a chili pepper that when you're applying it, you wear gloves. And then because if you wash your hands, like 2 days later, if you put your hands under warm water, it's gonna like flare. You're going to still feel that on your skin. But what it does is it kind of desensitizes. It's pretty good. So capsaicin. And then we have hyaluronic acid, which is really weird that it either comes from the comb on a chicken or a rooster, or it can be made by bacteria. But it's very thick, and it can be injected into your joints to increase the viscosity of your synovial fluid. It kind of lubricates your joint. So if you remember back again in those early chapters, I was talking about viscosity, which means thickness. So it makes this kind of syrupy, thick product that they can put in when your synovial fluid is kind of missing. And that creates a liquid bumper in your joints. So they can put this in and kind of replace that. Now, they also do this cosmetically, and they can inject it under your skin and kind of plump up your face and decrease your wrinkles. So you've maybe heard of hyaluronic acid cosmetically. Now, the prescription drug containing hyaluronic acid is called Halagen. So it is injectable. This is not going to be over the counter. This is not topical. And then we have combinations. So again, Arthrotec, there's a number of different ones that can be used for arthritis. They contain an NSAID, diclofenac, ibuprofen, naproxen, and then something to protect the stomach, an H2 blocker, a PPI, or something like Cytotec, a prostaglandin analog. And they're going to help block the production of hydrochloric acid in the stomach so we don't get drug-induced ulcers with long-term use. Next is rheumatoid arthritis. We refer to rheumatoid arthritis as RA. RA causes pain, inflammation, swelling of the joints, but it can also result in joint deformity and loss of joint function. The joints actually start to fuse together because RA is an autoimmune disorder, and the body attacks the joints and breaks down the tissues, and then it's basically bone on bone, and they can fuse together. It damages the cartilage and the connective tissues as well as the joint. So we've already talked about steroids. We've already talked about NSAIDs. We've already talked about salicylates and COX-2 inhibitors. Not only are they used for pain and inflammation, RA or OA, but also can be used for RA, especially a flare. We don't use acetaminophen in treating RA because it doesn't have any anti-inflammatory properties. So the first drug group are the 5 acetylsalicylic acid or 5-ASA drugs being used for salicylates. And it's not that there's 5 drugs, it's chemically referred to as a 5-ASA. This does include things like aspirin are in this group. Now the drug here is sulfasalazine, which is azulfidine. It's basically an immunosuppressant drug. It has anti-inflammatory properties, immunosuppression properties. It's also related to sulfonamides. So if somebody has an allergy to a sulfonamide antibiotic, they should not take this drug. And then also if they're allergic to aspirin, because it's got the salicylic, the salazine part. So we're looking at two drug stems here, sulfa and sala. So salicylic acid, azulfidine. Corticosteroids, again, we've talked about them. They reduce inflammation. They can be given orally. We use them short term for a flare-up. We can also inject it directly into the joint to relieve pain. Pretty much everything else kind of fits into what we call a DMARD. So DMARD stands for disease-modifying anti-rheumatic drug. So there's subclasses again. There's other drugs that fall into it, but these are drugs that are mostly, not all, reserved for rheumatoid arthritis. Now, psoriatic arthritis is another thing that's very similar to rheumatoid arthritis. It's a different disorder, but we use similar drugs. So now DMARDs, they can slow down the progression of the disorder by inhibiting the immune response. So that's why they're known as immunomodulators, or sometimes known as biological response modifiers. The DMARDs are biologic drugs. So a couple of things. With biologic drugs, most of them are stored in the refrigerator. They're expensive, and most of them are going to be through injection. So those are some things that should pop into your head that's pretty general about any immunomodulator biologic drug. Now, when we're talking about these DMARDs, we have some monoclonal antibodies, and we previously learned that a monoclonal antibody has the drug stem of MAB. This drug is adalimumab, so UMAB, and the drug is Humira, and this is given subcutaneously. And then we have the JAK inhibitors. We've learned about those previously. So JAK inhibitors end in citinib, or at least nib. So this drug is upadacitinib, which is Rinvoq. This is one of the newer ones that I'm hearing all the TV commercials for. And then we also have TNF inhibitors. These end in sept. So we have abatacept. This is known as Orencia. And all three of these are DMARDs. Now, your book also talks about the drug methotrexate, which comes by the brand name of Rheumatrex. But generally, methotrexate is, for rheumatoid arthritis, it's taken orally. And it's used for RA. But it can also be given intravenously for cancer. So it is considered to be a hazardous drug. It is a cancer drug. Also, to treat rheumatoid arthritis, we have a group of drugs that are known as gold compound drugs. So the elemental symbol for gold is AU. So we see this in the generic name, or Oranafin, and it starts with AU. And then we have Ridora, and we've got that AU in the middle. How we found out that gold helps with rheumatoid arthritis, they were thinking it was going to work for malaria, and it didn't. And then they found out it worked for rheumatoid. Now, this is oral, but there are formulations that are also injectable. And what they do is they affect the immune response. They inhibit the macrophages, which is a type of white blood cell that has a key role in the inflammatory response. So it stops those macrophages from coming in and invading and attacking those joints. So gold compounds for rheumatoid arthritis. So technically this is a DMARD as well, because it's for rheumatoid arthritis. We also use NSAIDs. Now, there is a risk if we use them long term. They can cause ulcers, but we can also use them for rheumatoid arthritis. But most often those are going to be used in a flare for a short term. Give a high dose like ibuprofen 800 milligrams kind of thing. Next are drugs that we use to treat osteoporosis. So osteoporosis is the thinning of the bone. So here in this image from your textbook, this on the left is a healthy bone. We see that there's firm structure. It's all organized. It's all very similar. And as the disease progresses, it gets more and more brittle, it thins out, and then the risk is going to be breaking your bone. Now, in bones, if and when you take A&P, you're going to learn a little bit more. But there's basically two major pieces to bone health. It's called remodeling. We have cells that build bone. Those are called osteoblasts with a B, build the bone. And then we have osteoclasts, which break down the bone or cause resorption. The balance of the buildup and the breakdown is controlled by the amount of calcium, which comes from our dietary intake and levels that are in our bloodstream, as well as vitamin D, which also comes from dietary intake and sunshine. Exercise is also a key to healthy bone. In women, the hormone estradiol, as well as progesterone, are help with the balance of healthy bones. For men, testosterone is the hormone that helps with the absorption of calcium and making the bones strong. Osteoporosis is more common in women than it is in men. Not to say men can't get it, but it is more common in women, especially postmenopausal, because they have lower levels of estrogen. So the drugs that we use, there's a long list of drugs. It would be dependent on the patient, the selection with the medications. So the first one are known as bisphosphonates. Bisphosphonates inhibit the action of the osteoclasts, so they stop the bone from getting broken down. They are bone resorption inhibitors. They have a drug stem of dronate. So the drug the prototype is alendronate, and it's known by the brand name of Fosamax. A few things about it, your book doesn't go into it, but patients are supposed to take this on an empty stomach. They need to take it with a full glass of water, and they can't lay down for 30 minutes. And they can't eat for an hour. So there's some stuff with that. This is for women who are postmenopausal. And you see on the tablet, there's a little bone, because it's for bone health. So you're looking for dronate or dronic as your drug stem to identify that group of drugs. Your next group are the calcitonin hormone drugs. So calcitonin is actually a hormone that your body secretes from your thyroid gland, and it's balanced by your parathyroid hormone. What calcitonin does is it moves calcium from the blood and brings it to the bone to help increase bone density. And it helps prevent bone loss by inhibiting that parathyroid hormone, because that parathyroid hormone is the other side. If you need more calcium in your blood because you need calcium for blood clotting and muscles, it's not all going to your bone. The parathyroid hormone is going to help pull the calcium from your bones. So calcitonin is going to kind of stop the action of the parathyroid. Now the drug we use is called calcitonin salmon, and it's primarily administered intranasally for osteoporosis. So miacalcin is the image. So we would take the cap off and we would insert the spray into it, and then the patient would take it home. Until we open it, we're going to keep it in the refrigerator, but once the patient takes it home, it doesn't have to be refrigerated. And they're just going to inject it, and they're going to alternate. On Monday, they put it on one side nose. On Tuesday, they put it into the other side. So this is calcitonin salmon. Miacalcin is one of the main brand names. The other is Fortical. We can also use estrogen derivatives to treat osteoporosis, especially women postmenopausal. Estrogen is a hormone that facilitates the absorption of calcium and will inhibit the breakdown from the osteoclasts. And they have the drug stem of estra. Estrogen derivatives are used postmenopausal, and there's a definitive time span. And this is conjugated estrogen, which is known as Premarin. And somewhere in your book, I think it was in the earlier chapters, they actually purify the estrogen from the urine of a pregnant mare, so from a pregnant horse. And that's where the brand name came from, Premarin, pregnant mare's urine. So they purify the urine and extract the estrogen, and then they can chemically make the drug. And that's going to help elevate the estrogen levels, which will help decrease the risk of osteoporosis. We also have parathyroid hormone drugs. Parathyroid hormone will normally raise calcium levels in the blood by pulling the stores from the bone. But the key to using a parathyroid hormone drug is that they can stimulate osteoblasts, which rebuild bone in greater amounts than the cells that break it down. These have the drug stem of paratide, and teriparatide. Forteo is the drug, and this is also an injectable given subcutaneously. Then we have RANKL inhibitors. So RANKL stands for receptor activator of nuclear factor kappa beta ligand. Yeah, you're left scratching your head. What the heck? We're just going to call them RANKL inhibitors. But that chemical is a member of a tumor necrosing factor family. And it's secreted by osteoblasts, which activate the osteoclasts. So a RANKL inhibitor is going to block the activation of the osteoclasts. So it's going to let the blast build up, but it's going to stop those clasts from coming in and breaking it down. These are also biologics. They're considered to be a monoclonal. They're one family antibody. So they end in mab, but the RANKL inhibitors end in sumab or zimab. They kind of sound similar. And we have denosumab, which is Prolia. And this is given postmenopausal women as well. And it's given subcutaneously. Next, we have what are known as SERMs. These are selective estrogen receptor modulators. Again, estrogen is important for women for good, healthy, strong bones. So the drugs that we use that are SERMs for osteoporosis bind and stimulate estrogen receptors on the bone. They decrease the bone resorption and the loss of bone mass, and they help increase bone mass and mineral density. These drugs end in Exifen, and this is raloxifene. I like Oxafen. The book put just the Exifen, but I like the Oxafen myself. Plus it rolls a little easier off your tongue. Raloxifene is known by the brand name Evista. And then we do have combination drugs. So these are combinations of estrogen and progestin. They can be taken orally or they can absorb transdermally, so they do come in a patch. It is important to know any drug, including Premarin that I've already talked about, that increases estrogen levels, either directly or indirectly, increases a patient's risk of blood clots. So there's two main that I'm focusing on combinations. The first one is a combination of estradiol with norethindrone. Now, to be honest, these are also combinations that are used in birth control. But this medication is meant for a postmenopausal woman. So this is not meant as birth control, although it looks like a birth control. What it's going to do is keep the woman cycling properly. So we do use it for menopause as well, but it's helping with, in this instance, we're concerned with keeping those osteoblasts doing a good job. So it's a combination of estradiol with norethindrone. We have Activella, and this comes in a cassette. We have Comba patch, so this would be the transdermal patch. Lopreza is another brand name, and this is the back side. It kind of 4-week cycle. And then we also have Mimvi. So the book listed all of these combinations out differently because I'm looking at them, they're all the same strength. So this one is not, the patch is not, and I can't read. Oh, there we go. So the orals all are the same mix. So I don't know why the author chose to just list each one out separately, but I grouped all of the ones that contain the same ingredients in the combination. The other combination is conjugated estrogens with medroxyprogesterone. So that includes Prempro. Medroxyprogesterone is also known by the brand name Provera. So we've got Premarin and Provera. That's where the Prempro came out of. And then it's also available by the drug name Premphase, where you've got the estrogen on one level and you've got the progestin on the next. Over here, it's mixed for the whole time the patient's taking it. Over here, half a month they're doing estrogen, the other half they're doing progestins. Now, over-the-counter calcium supplements can also be used in adjunction to a prescription drug. However, prescription calcium is not indicated for treatment of osteoporosis. Vitamin D will act on osteoblasts to stimulate bone formation. Also to note, vitamin K, not potassium, there's actually a fat-soluble vitamin known as vitamin K, can also help absorb the minerals calcium and phosphorus. Exposure to sunlight produces both vitamin D and vitamin K in the skin and can help prevent osteoporosis. However, prescription vitamin D drugs and prescription vitamin K drugs are not used in treatment of osteoporosis. All right, so let's finish up these questions.